And now on the line is Paula Leonard, the CEO of the Alcohol Forum. Paula, welcome back to Near FM.
Hi, Darren. Thank you very much for having us on again.
Okay, I last spoke to you on Near FM, Paula, nearly 2 months ago, and since then you have a new job with the Alcohol Forum. Could you tell our listeners today on Near FM, Paula, about your new job and how you're getting on?
Oh, I can, of course. I suppose last night we marked the retirement of Kieran Doherty, who's been our CEO for the last almost 9 years. And I'm very excited about taking up the post because Alcohol Forum Ireland really, Darren, has grown from what was quite a small local Donegal-based charity to now providing a range of supports and services to families, in particular children and adults who are impacted either by their own alcohol use or by a family member's alcohol use. So we provide services in Cavan, Monaghan, Donegal, Sligo and Leitrim, and we then work at a national level. I've talked to you previously on a number of occasions about some of that work. So we would be involved in policy. We would lead nationally on community action on alcohol. We would have developed what has now become the globally renowned IMARC, which is a mark of independence from alcohol industry influence. And I suppose we would have been part of the founder members of the World Assembly on Community Action on Alcohol. So it's a great organisation to be coming into and to be leading at this time. And I think there's really exciting things ahead for the charity. And there's no doubt when you sit at an event like last night's that looks at the burden that alcohol places on health services and hospital services, there's no doubt that there's a need for an independent charity like ours, and there's no doubt that there's a huge value in the work that we do.
Okay, congratulations on the new job anyway. And you mentioned you had a big event last night. Along with the retirement due of your last CEO, you had a conference, didn't you? Can you tell us more about it?
We did. We had a seminar last night that really was about having the conversation around, well, what burden does alcohol place on hospital services, and what do we do about that, and what can we do about that, so that we weren't just staying in the problem place. And we were privileged to have, an internationally renowned expert on that, Sir Ian Gilmore, over from the UK last night. And really, Ian was describing that for the first 30 years, I suppose, almost 30 years of his professional career as a liver specialist, that he had spent a lot of time focusing on, crisis management and pulling people out of the water when they were drowning. And then he really felt that there was a need to start to look at prevention work and what you needed to do. And so he became, one of the founder members of the British Public Health Alcohol Alliance, which is a very significant player, I suppose, in terms of prevention and policy work on alcohol in the UK. So it was really interesting to listen to that in terms of, the burden that alcohol places on health services is significant, but there are things that we can do about it, and there's things that we can do in the public health space. There's things like the Irish government have brought forward, the Public Health Alcohol Act, and then there are threats to that, like the bringing forward of the sale of alcohol bill that we're seeing right now by the Irish government. So I think that the voice of, independent charities like ours and Alcohol Action Ireland and, the Irish Community Action and Alcohol Network, it's really important that all of us exist, and it's really important that all of us have our voices heard and raise the concerns that communities have on policy issues. And I mean, last night we heard some very frightening statistics. Earlier today and yesterday there was some coverage, that alcohol consumption in Ireland is coming down, but really alcohol harm in Ireland isn't. And I suppose that's a sort of an anomaly, because it's not just to do with the level of population consumption that we drink as a country, it's to do with the pattern of our consumption. So we have quite a high number of people, adults in this country, who don't drink at all. And when you take them out of the statistics, those of us who are drinking in quite a dangerous way. So between 1995 and 2018, we heard last night, you had alcoholic liver disease discharges had increased for men by 247% and by women for 175%. Those are very frightening figures, but I suppose growing up I always had a stereotype or a profile of somebody, with alcoholic liver disease as an older male for whatever reason. But the most frightening thing, I suppose, one of the things I would have heard last night is that for those people aged 15 years of age and 34 years of age, we have had a 211% increase in alcoholic liver disease in this country. And that's something that not just alcohol charities, all health services, all youth services, all government departments, we all need to be equally concerned about that. And we need to be saying, well, how do we change that statistic? Or are we just going to keep placing a greater and greater burden on hospital services and health services to deal with that in crisis mode? And so while we really welcome the small decreases that we've seen in population level consumption, and I think there is some cause for celebrating and saying that decrease may be attributable to what's been in the Public Health Alcohol Act. Overall, the overall picture, when you take a step back, isn't great right now. And one of the things that I suppose Anne Doyle from the Health Research Board, who also presented last night, was saying is, the figures from hospital-related discharges in relation to alcohol doesn't really account for, things like alcohol-related cancers. So it's very hard to get a really accurate picture on what is happening in Irish hospitals because of alcohol. So it's not just the behavioural, the mental health issues. It's not just the falls, the injuries, the road traffic accidents, the very well-known and established relationship with alcoholic liver disease. It's a whole range of other things as well. And I think we need to all just pause and think about what we do. And last night was a good place to start.
You mentioned there all the kind of things with alcohol effects that can have the negative effects. Like one thing you didn't mention that I'm conscious of is the effect or the connection for some people with violence. That's a huge issue on the weekends in particular, isn't it?
Absolutely. The alcohol fueled or alcohol related violence. A paper came out yesterday from the UK, and it's not just what we would think of traditionally as your antisocial behaviour or your violence in the nighttime economy. That paper was showing a clear link with increased domestic violence associated with drinking in the nighttime economy, late night presentations at ED, sexual assault units and those things. So I mean, we have a problem in this country with alcohol, as we do in most European countries. I mean, we're the highest consumers of alcohol on the globe, us Europeans. We need to think about that. I mean, while there is some celebration that are I suppose what we know and what we're seeing, in the way back, we know this for quite a long time. There was a rape and justice report about domestic and sexual-based violence in Ireland numbers of years ago, and what they found was that, alcohol is not the cause of domestic or gender-based violence, but it does fuel the incidence within relationships. It increases them. It places women at greater risk within violent relationships. The most vicious assaults happen when the perpetrator has consumed a lot of alcohol. And these are things that we're just going to have to tackle. And I don't think it's good enough anymore for us to say that these are difficult conversations. We need to have them. We need to start talking about it and thinking about it. And we need to start responding to it.
You had a speaker from Beaumont Hospital as well yesterday. Just let you know, Beaumont Hospital is in the catchment area of Near FM. Can you tell us a bit more about the speaker from them and who they are?
Yeah, we had Professor John Ryan, from the Beaumont Alcohol Care Initiative. And what they're doing is actually, they are pulling together all of their services, and they've set up like an alcohol care team. I suppose we had Professor John Ryan from Beaumont, who is a liver specialist and who has published in relation to the increasing concern and the increasing rates of alcoholic liver disease in this country and what they're seeing and the increase in deaths. But, John also presented giving people a little bit of hope. They have done a lot of work on the Beaumont Alcohol Care Initiative, which is really bringing people together in an interdisciplinary way to say, what can we do about this? How can we start to diagnose the condition better, to prevent the condition better? How can we start to set up an alcohol care team, so that you have better integrated care of patients with an alcoholic liver disease? So, according to himself, it's early days for that, but it's lovely to see that level of commitment within a hospital. And I think the Beaumont, with the Alcohol Care Initiative, really is a beacon of hope for others. And, we had hospital management there last night from our local hospital in Letterkenny, and I had some discussions with them afterwards about how we might model some of that work up here in the Northwest. So there's always, the additional things that may come out of an evening like last night that are quite exciting and, great. They do give you more work, but they're great to happen. So that's really been us.
Okay, Paula, come towards the end of the interview, you mentioned a few things like that could or should happen in Ireland on the kind of community level and the health services level, but from the point of view of government, can you tell me in the short to medium term what you are calling for in terms of public health alcohol policy going forward?
Well, I think the single biggest thing that's facing us right now as a country is the proposed sale of alcohol bill. The proposed sale of alcohol bill came forward last October to Cabinet, and it is moving, at pretty good speed through the legislative process. And what we have not seen is we've not seen a health impact assessment from the Department of Health to say what it would mean in terms of health, even though the HSE made a submission to say there would be definite consequences for hospital call-outs, emergency department presentations, injuries, accidents. So, the HSE are very clear that there'll be consequences. The Garda Síochána were very clear in their submission that there would be consequences in relation to would they have the capacity to meet the increased demand in the late nighttime economy. So we are worried. We're very worried. We've also not seen the Department of Children speak to the parts of the proposed bill that will have an impact on children and that will increase the risk for children in the proposed sale of alcohol bill. So we're calling on, the Minister for Health to look at this. We're calling on the Minister for Children to take a very robust look at this, and we're calling on the Minister for Justice to slow this down until such a time as a health impact assessment, a proper health impact assessment, could be done. There is no way around it. If you liberalise the alcohol licensing regime, if you extend the hours at which alcohol can be served, so we have provision now for late bars up until 2:30 and nightclub serving till 5 a.m. And if you get rid of the limit that there is on the number of alcohol licenses within a population, you can't avoid an increased level of alcohol harm. And I don't think we have given that reality enough attention within the debates to date on this.
And you're talking there about the public health or the sale of alcohol bill. You're also calling as well in the alcohol forum for the full implementation of the Public Health Alcohol Act, aren't you?
We absolutely are, as are ICANN, the Institute for Public Health, the Alcohol Action Ireland. There are several groups that have given some time looking at and scrutinising this and saying, we bravely got it over the line in 2018, but we're still awaiting the implementation of particular measures. We have minimum unit price. it may be looking like that might be a contributory factor to alcohol consumption coming down, but we've had horrific levels of alcohol brand marketing at recent rugby matches. So, the Minister needs to take a look at that again and say, does he need to bring brand marketing rather than alcohol product marketing into the legislation as well? But, as a very next step, the Minister for Health needs to implement the Public Health Alcohol Act in full.